Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Krynen Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
Hello, hello. Happy Thursday, everybody.
Hello, everyone.
Hello.
We also love celebrating wins in the Concussion Fix program. This week, we are celebrating who started at 42 out of 132 and was down to 11 in 12 months. And who started at 68 and out of 132 and is also down to 11 in 13 months. So congratulations to both of them. We can go to our first question.
Hey, I just want to say thank you for the course. It's been amazing. I'm probably going to be checking out before the 21st of this month because I've been doing it for like nearly 1 year and 5 months. I've been a bit slow, but it's been amazing. So thank you all. Just quickly, I've got a major problem with my piriformis, I think. Is that what it's called? Like in your butt cheek hamstring type of thing. And when I was last in Australia, I got like 4 different massages and no one seems to be able to help me. And I got a massage the other day. I'm back in Bali and it's just like this pain in my butt, but my hamstring. And I'm just like, I know that this is all about your neck and whatever, but I'm just like, how the heck can I get help to fix this?
So aside from concussions, my second favorite thing is hips.
Okay.
And a lot of times when there's like glute tightness, sorry, I'm a little bit sick today, so I'm trying to deal with my throat. When you have like a piriformis issue or, tension in the muscles of the hip, a lot of times that's related to the SI joints.
Mm-hmm.
So, and I've picked this up on so many people, but if you are getting soft tissue work and it's just not letting go, there's a good chance that tightness is a reaction due to issues with the SI joint. So where your pelvis meets with your sacrum, right? So the sacrum is the very bottom part of the spine, and then you have your pelvis, which is kind of, forms a ring around it. The pelvis is actually kind of 2 separate sides. They join at the front at the pubic symphysis, but then they also join at the back at the sacrum. So that's the SI joint, sacroiliac joint. So the pelvic bone there is called the ilium. So it's a sacroiliac joint right there. And what can happen is that the one side of the pelvis can kind of shift, right? It can either rotate forward or rotate backwards in relation to the other one. When that happens, the muscles around it, like your glute medius, your piriformis, all those muscles tend to grab on. because they don't kind of like how things are sitting. And then so you can get tissue work and someone will loosen that up, but it just comes right back. And the reason is because that SI joint is a little bit, out of whack. So the treatment for it is a combination of doing some soft tissue. So I do a hip protocol that I do a lot of times with people. And the problem is that, like, even the patients I see, they've been to 15 other people and no one can fix it. And then it's because they don't necessarily do this type of stuff. So it can be tricky to find. But I can kind of send you my hip protocol and you might be able to like give that to a practitioner and maybe they can do it. But I basically
because I'm so over it. I've had it since December last year, and it's like, oh my God, and it's like the biggest pain in the butt ever, and it like that's what it is.
Yeah. I mean, I'll just kind of summarize it here, but I'll lay the person on their back and I do some hamstring work with ART. So I bend the knee and then I put some pressure and then I extend the knee and I also flex the hip forward and on your back. So I'm bringing your knee up like this and then I'm having you straighten your leg and I'm working on your hamstrings. So the first thing I do is loosen up the hamstrings. Then I flip you on your side so that the bad side is up, the good side down. And then I'll do some glute medius work and then I'll do some piriformis tissue work, and then I'll do some TFL, which is the tensor fascia lata, which is on the kind of front side a bit. And then I may do some like psoas work, like I may lay you on your back and do some work through the hip flexors as well, depending on what's going on. And then from there, I take a look at the pelvis. So if I lie you down on your stomach, I'll look at your leg lengths, and you'll generally see one of them will be longer than the other. Right? So that most of the time leg lengths are not actually that the leg is longer, but it's because the pelvis is shifted, so one is sitting lower. So you can see that, but then I'll go up to the pelvis and I'll take my thumbs and put them right on the bones at the bottom called the PIIS. You put it on there and you'll see that one is up like this and the other one is down. So then that means that either this pelvis is rotated forwards or this pelvis is rotated backwards or some combination. And then what I do is I do some kind of sacral adjustments and then see how that works. And then if that evens out, great. If not, then I'll adjust the actual like hip bone forward and backwards until I get them level. Then when I get them level, I usually will try to adjust the pubic symphysis too at the front. And that way
that's a lot of things.
It's a lot of things, right? So like trying to find somebody that does that. Generally, you're probably thinking chiro. Massage is great for the tissue work, but like I said, a lot of times it's a SI problem and you won't get anywhere with just the tissue work.
Yeah. Okay.
Yeah.
Yeah. Awesome. Thank you. And one more.
Are you still in Bali? Are you still in Bali? Or are you heading back to Australia or what?
I was in Australia, but no, I'm back in Bali again. I kind of just go back and forth. But yeah, I had a lot of different people in Australia work on me, and it felt good for like a minute and then bang, just straight back again. So so I think, and I know it is my hips because my hips have always been dodgy. Like I've had 3 really big babies and I think I've never been the same again.
Yeah, well so what happens in pregnancy is that you get a release of hormones that will make everything expand, right? And then when it all comes back together, oftentimes it's not sitting quite right. So that's a common thing with both pregnancy and postpartum, is that people will have these kind of hip issues. Being pregnant alters your biomechanics completely.
And then lying down for 2 years with like brain injury and concussion and bloody fractured neck, I don't think that helped.
No, definitely not.
No.
Definitely not. So I mean, you can send me a message on the platform before you check out, and I'll just kind of write down what I said.
Yeah, awesome.
And then you can maybe take that and see if somebody can make sense of it.
Yeah. Thank you. And thank you so much. I'm so much better. It's my neck feels good and everything, but just now my whatever that anyway. But thanks guys. And just sorry, one more question. With the diet, everyone's saying, you got to eat protein and the diet and the concussion fix is I've done all that, but it's just I want to start doing vegetable juices, and everyone's like, no, don't do vegetable juices because it's just a big boost of sugar going straight to you. Is that true? Like in the mornings?
Yeah, so that's an interesting conundrum that I've wrestled with since I started practice, because you have a whole school of thought where it's like, going vegan, and which is generally hard to get lots of protein. And then along with these types of quote unquote cleanses, come a lot of vegetable juices and fruit juices. I think that there's a role for, just like fasting, there's a lot of research that's emerging on fasting, even fasting that's 24 hours, 36 hours, so longer periods of fasting, 48 hours, where you start getting what's called autophagy. So there's beneficial things that happen. However, you can't fast all the time, right? You need to fuel yourself. So these are short periods that you actually incorporate some of these kind of more, I would say, extreme ways of changing your diet. And I've seen in my patients dramatic improvements in lowering inflammatory markers when they do these types of fasting. But the trade-off is that it's hard to do. The reason I'm bringing up fasting in the context of your question is that I think juicing, and I think going on, let's say, a 3-day, very easy to digest, very like low protein, just very plant-based diet, I think in some ways is going to give you a lot of beneficial effects because it's a lot easier on your digestive system. The idea here isn't to increase anabolism and increase muscle growth during these periods of time. So I think what you're talking about, you have to look at short kind of detoxes. There's a role for these vegetable juices. On an everyday level, if every single day you're starting your day with some sort of fruit and juice, and you're not eating any sort of food, you are going to get blood sugar spikes over time with that. I think you can incorporate vegetable juices into your day as part of a diet that is like one that's described in the Concussion Fix, like a Paleolithic style diet where you're really avoiding high processed, ultra processed foods, and you're avoiding high sugar foods. So I think there's a role on the long term for that, because it's kind of like a really high dose of nutrition in one serving. That's the whole idea between eating a chicken breast, which is 30 grams of protein, versus having a protein shake. Which one's easier to consume? The protein shake is a lot easier to drink, obviously, right? So there's an ease of delivery. So that sometimes makes it easier to augment a person's diet with adding in some of these things like a green juice rather than eating a huge bowl of salad, for example. So there's a balance between ease of use, high nutritional value, and then also what are you going to do short term versus what are you going to do long term, and what are you going to do consistently. Does that make sense?
Yep. Yeah, it does for sure. Thank you.
Yeah, you're welcome. I will say finally for everybody listening, the sugar that comes from fruit and vegetables is very different metabolically than sugar that comes from ultra processed foods. There's lots of research showing this, that it's not just about eating fruits and vegetables that's going to increase sugar, that's going to cause things like diabetes solely. It really is the combination of high fructose corn syrup, cane sugar, and a lot of these highly processed refined fats that are typically higher in omega-6 in combination, that I think is what now is being termed ultra processed foods, is really being the driving factor as the problem. So there's lots of studies showing eating blueberries, which are high in sugar, it doesn't have a detrimental effect on blood sugar and inflammatory markers.
Perfect. Thank you.
All right.
So I have 3 questions. I'm hoping the first 2 will be quite quick, and then the third one might take a bit more time. So the first one is, like we do those questionnaires on the thing in the modules.
Yep.
But when I go back to it, I can't see what my score is. Is there any, is that collected by you guys? Is there any way that if I message you, would you be able to tell me what? Because I think I've done the questionnaires twice now.
You can see them on the side of the news feed. So if you go to the news feed on the platform and you scroll down, all of your quiz results are on the side.
Oh, okay, awesome. Okay, so I'm going to look because I'm still like, I've done like the modules, like all the information modules, and I think I've done the mindset one, but I think I've still got some more work to do on mindset, and then starting the next module, which I can't remember which one it is, but like, yeah, but I'm still really early on, but I think I've done the quizzes twice. So I'm just curious about what's going on.
Yeah.
And also I think my mood really impacts the way I respond to the quiz. So if I responded to the quiz on a day that I'm really having a bad day, like I'm pretty sure the score is going to be worse than on a day that I'm having a good day.
That's why mood is such an important factor for concussion.
Yeah, definitely.
Right? One of the things that actually, like with my other company, Complete Concussions, we have a clinical network, and so we get approached by researchers that want to just look at anonymized data to try and use that huge data set for just understanding concussion better. And one of the things that they're interested in is how does the scores on the mood questionnaires influence symptoms? And my bet would be that it would be quite a high correlation between the two.
Yeah, I mean, definitely my experience so far, just on a day-to-day basis, like last week, my mood was so low. Like, I think it's the most depressed that I've been in a really long time. And like, obviously, if you've got low mood, that's going to impact energy, fatigue, and all of those things. And it does sometimes feel like a bit of a chicken and egg. So like, how do I so I think there's still a lot for me to do on the kind of mood and emotional side. But anyway, so so I'm really aware of that and really grateful that that's where you start on this program. The second question that I have is, but it's kind of linked to my third question, but obviously because I'm not there yet on the program, the exercise piece, I want to know, like, so I don't want to like not move my body at all, like as I'm working quite slowly through the program, but I don't want to move in a way that exacerbates the symptoms. So I've started off, well, I'm doing like only 1,600 steps a day because I think that's what I at the moment can manage. So that's about 15 minutes of like walking. But today I met a friend. I've slept really well the last 2 days. I was feeling really resourced. I met a friend for brunch. We sat outside so it was a bit quieter. And then like we went for a walk, and so that was like 3,000 steps overall rather than 1,600, but I also walked faster than normal. And so I've now got this really weird headache that I don't know how to describe what the sensations are, because it's not like a headache that's painful. So I kind of also want help to like, how do I describe this headache that I'm experiencing? So there's definitely some symptomatic stuff that's happened. So I don't know, like, should I, because obviously I'm not there at that module yet. Do I just stick with walking slower but start increasing my steps, or do I try and stick with the 1,600 steps a day but play with pace? Like, see like, do I increase the pace and see if it becomes symptomatic? Am I even making sense?
I got you. Okay, so when you're first starting out, I don't necessarily care about the number of steps or anything like that. Generally, you just want to get, 20 to 30 minutes of light exercise every day. Like 20 to 30 minutes, that's it. As long as you can go for a walk for 20 to 30 minutes, don't really worry about the pace. Just go on a nice, relaxing walk for now. You just want to have movement at this point.
Okay.
Then when you get to the exercise module, that means that you've already handled the mindset, you're already working on diet, your sleep is improving, you're doing all those things. That will help when you go to add in the exercise piece. And then the exercise piece, when you get there, is again 20 to 30 minutes, but now you're paying attention to heart rate. So you start off with your normal pace and see what your heart rate is at that pace. If you're fine with that heart rate, then the next day you try to increase that by a few percentage points, right? So let's say your heart rate gets up to 110 when you're walking, and that's your kind of average through that 20 to 30 minutes, and you don't have any increase in symptoms with that. The next day, try going up to 115 to 120. See how you feel with that, 20 to 30 minutes. The next day, if you don't have any issues there, then you try to go up to 125 to 130. And if you don't have any issues there, then you move up again. And you keep doing that until you hit that threshold. Either that heart rate starts to cause symptoms during or even after the exercise. Once you hit that point, you know that, okay, that's my current limit. I'm going to go back to the previous step where it wasn't bothering me, and I'm going to do that for 1 to 2 weeks at that rate. After 1 to 2 weeks at that rate, then you try the next stage again to see if you're okay with it. If you're okay with that, then you bump it up again. If you're okay with that, you bump it up again. Oh, this one increased my symptoms, drop back to the previous stage, stay there for 1 to 2 weeks, then reattempt the next one. And you keep doing that because you want to stay sub-symptom threshold. You want to stay below the symptom threshold. So for now, just 20 to 30 minutes a day, nice easy pace. It's just to get your body moving, get outside, get the mental health benefits of some light exercise. You're not worrying about intensity at this point.
And then the other thing as well is being able to differentiate what's triggered the symptoms, because obviously I went for brunch, so there was noise and sound, which I'm very sensitive to. And then I live in London, so obviously if you're walking anywhere in London, you're going to get like the trucks and the buses, like they're so like, I don't know how I didn't notice how loud they were before, but they are so loud. So like how much of this, like, so I haven't been able to differentiate, like, if I was walking at that pace somewhere completely quiet, would I be as symptomatic as I was walking in a place with loads of noise or sound, I should say, because it's noise to me, but it's just sound. But then the other thing is that this kind of post-exertion malaise. So like I am symptomatic now because I've got this really weird headache that I can't really describe. But then there's also sometimes where I experience no symptoms, but then I am completely wiped out like for the next few days. And I'm still kind of struggling to just figure out like what's gonna, because almost when you have the symptoms in the moment, then it's easier to manage. But if you're having the delayed symptoms, it's really hard to know what to do.
Yeah. And like we said with this, it's like you're trying to play the kind of symptom chasing game.
Okay.
Right? Like what caused this, what caused that, what caused this? It doesn't work. It doesn't work like that. Because what caused it? Was it the noise? Was it the exertion level? Was it something else? Who knows? Was it the visual motion of the crowd of people and the movement and everything? Who knows? Because all of these things, even like, post-exertion malaise is what you called it, that's related to anxiety, mood. It's related to autonomic issues. It's related to inflammatory and gut issues. It's related to sleep dysregulation. It's related to all of those things. So rather than trying to pinpoint the exact thing that caused that, forget about it. Just work on the systems that drive all symptoms. And that's just following the steps in the program, right? Don't try to pinpoint exactly what and this and that. You just work on the process.
Okay.
All right? Because you'll drive yourself crazy trying to figure out every little kind of in and out.
That's actually really helpful, because I think that's what you're right, I totally drive myself crazy trying to, because then it's all about control, right? Then I get into this thing about like needing to be in control and trying to, and then that obviously then impacts anxiety, because obviously that need to be in control is it relates to like anxiety, and then that's exacerbating this, so it all just then gets really, I don't know if that makes sense, like, so you end up in this like cycle.
Yeah, I mean, I do encourage people to like isolate certain variables, right? Like, for example, if you're going to do exercise, do it in a controlled environment so that it's the exercise or not. Because if you go and do your exercise in the middle of a busy city and you're talking as you're doing it, and there's all sorts of different things. So you're trying to pay attention to a cognitive conversation. You're trying to talk as you walk. You're walking at a faster pace to keep up with the other individual.
Yeah.
It's going to throw all sorts of different variables at you. So which was the one that drove the issue? We don't know, right? But if you were to do it in a controlled environment, let's say on a treadmill in your house with no noise, it's the exercise because there's nothing else really happening there. So we do like to isolate variables, especially with things like exercise. But ultimately, you don't want to get too concerned over which one of these issues was the trigger. It doesn't really kind of matter. You want to continue to do things and expose yourself to these things because all of that is therapeutic, while at the same time you want to work on building the resilience in your system to actually get rid of those issues to begin with, right? Because fatigue, brain fog, all these things are related to every single potential one of these drivers. And you're never going to pinpoint it one symptom at a time. You have to just work on the underlying drivers as a whole, and that brings everything together, because then all symptoms are from those things.
Yeah, thank you. And then just to describe this headache, because I don't know why I feel like I want words to be able to describe it. And I think JP in the chat, that's been really helpful. But it's like I have a ringing in my ears, but I don't have a sound of ringing. But it's a sensation. That doesn't make any sense. Or it's like my head feels like it's exploding from the inside, but also pressure from the outside, but it isn't pain. So I don't know if that even makes sense, but it's like I want to be able to describe what this sensation is, even though I can't really fully describe it. Does that make sense?
Yeah.
Because I say ringing in my ears, but I'm not hearing sound, but it's just this weird sensation.
Yeah. Is it like visually, like you feel off?
So occasionally I struggle for my eyes to focus. So like if, for example, I do coaching and training for work, and so sometimes if the sessions are quite complex cognitively, I can notice my eyes like start losing focus, and I struggle to but then I don't always have the ringing in the ringing in the ears. I don't know, it's like a pressure feeling, and like when your ears are about to pop but they're not popping, but it's
So
not
like
painful.
like a
But
fullness.
it's not painful. It's
Is it
just
like would you describe it like a fullness?
yeah, maybe. And then it comes down to my jaw. So like, this is going to sound really bizarre, but when you're feeling nauseous and you feel this weird sensations around your mouth and your jaws, I don't feel nauseous, but I feel like it's like a tension or a ting. I can't really describe it. Like a tightness, but it's not feeling tight. It's really weird.
Yeah, I mean, it could be TMJ and the upper neck. That affects ears, and it makes ears feel full. Sometimes even tension in the SCM muscle here is associated with that kind of ringing sensation in the ears. Pressure in the head could be related to inflammation, autonomic, neck, right? So again, you're trying to find the exact thing, but it could be 4 or 5 different things. So all we can do is work on each of the 4 or 5 different things, and then that helps. You know what I mean?
Yeah.
Like rather than trying to chase individual symptoms and worrying about what this could be or what that could be, it's like just work on all the systems in a holistic way, and that stuff just tends to go away, or at least a big portion of it goes away, and now you're left with maybe one small point that's easier to pinpoint what it is.
Yeah.
Right?
Thank you.
Because if there's multiple overlapping things, your headache could be really weird and fit multiple categories, and now you're concerned. Now you're confused. But once you start knocking off those categories, it may turn out that like, oh yeah, no, the really big thing I'm feeling is like in my jaw, and now okay, that's a TMJ issue. That's easy to now point to. That's the thing, right?
Got you. Yeah. So at the moment, I've been really slow at working through everything. So I know I still feel like I'm very much at the beginning of this journey, but I hear you. So that the more I kind of work through these systems, the easier it'll be to identify where I need that support.
Yeah,
so
there's kind of
like you say, TMJ.
There's kind of an inflection point. Like it's like the starting of this is really slow and gradual, right? Like it's very like, okay, not much, not, and then all of a sudden it starts to just go, and you kind of get this acceleration as all those things come together, right? So it's fine to take your time. It's fine to go slow. It's actually encouraged to go slow because you're building more structure. If you think about it from like an investing standpoint, it's like when you're first starting to like put money into an account, it's like nothing. But as that compounds, now you get, it goes better over time, right? So it's just compounding.
Thank
I
you.
wanted to add to that as well, because, I think part of the recovery mindset invites you to sort of get to know your own patterns and your own ways of getting stuck. And so I think what Dr. Kam was just helping you with was that sense of like needing to understand how it all fits together, understand which symptom goes with what. And so part of, as you go through the recovery mindset, if you haven't been through it yet, is just that sense of what the term we call decentering. Can we step away from needing to know how all the pieces fit together and just kind of trust the process a little bit, but also knowing, is there a way to simplify it so that you can reassure yourself in a sense without having to know all the details. So it might be more that pulling back on that need to know all the little pieces and how they fit, and more resting in like, can I get an overall sense of how I can feel safe in my body right now. So I'm hearing, naming it is important for you, right? So naming this sense of how do I describe this sensation in my head? It seems important that naming it is something that will help you feel safe and calmer. So that's great. You can do that. And then it might be, okay, do I need to take that extra step further to describe all the ways I should approach it, right? That might be the part that you bench. So first we're talking about like psychological coping skills, right? Okay, I have this really confusing sensation in my head. I can't describe it. Just living with that while I try to figure out the whys is too much. So there's certain ways you can kind of work with that. You'll learn skills in the recovery mindset to help support you. And then also learn to build up some what we call distress tolerance, so that you don't have to figure out all the whys associated with those symptoms, right? That's later and it will come naturally. But that's how you kind of develop this like mental resilience, is recognizing what your needs are, which I think you've described well for us, right? It's important to you to know how to like name and understand what's happening without necessarily needing to know all the details and all the whys and how all the pieces fit together. That may be the part around distress tolerance that you can work on building, where it's okay not to know some of those things while I work on each step of the program.
Thank you, Melinda. That is so unbelievably helpful, because I am a human that goes into analysis paralysis, and yeah, that kind of trying to get underneath the why. And I think you're right, like being able to say, okay, these are my symptoms, this is what I'm noticing, and then doing what I need to do to kind of take care of that. So for today, it's going to be like the rest of the day off screens, and like taking care of myself for the rest of the day. And like you say, like being able to just create that distance, that's really helpful, because I don't always catch myself when I'm in that space. So yeah, really grateful for that observation.
Yeah, right. There's this saying that I share in the recovery mindset: name it to tame it, right? You can know what's happening, and then it actually eases off that emotional distress, because we're putting a name to it, we're compartmentalizing it, we're allowing ourselves to have the experience. We're not trying to force it to go away. We're allowing ourselves to have the experience without having to figure out every single part of it, right? It's building that tolerance to some uncertainty. That is actually just a helpful skill as you go through PCS as well. So I think you're kind of understanding that now, which will be helpful moving forward.
Yeah, absolutely. I think that's just absolutely, spot on. I think you're right. I think there's something about needing to name it as part of that process, but it's kind of like the second arrow. Like I then go down the second arrow route around, like, okay, I've named it, but now I add all these extra layers, like, which is really unhelpful.
Yeah, and you might just say, whoa, I already have done that before. It's not helpful. Do I need to go there again? Probably not.
Yeah.
Can I, physically get up and move my body so I don't mentally just go into that automatic pattern? Sometimes it's breaking the cycle by physically moving your body out of wherever you're sitting in that moment, or wherever you're feeling you're ruminating about it. There's some different strategies you can use to sort of try to break that cycle, per se.
Thank you so much. I really appreciate it.
You're welcome.
All right, next up is
So my question is about neck rehab and chiropractors. So I've gone to 3 so far, and I still kind of have neck pain, and I feel like it hasn't really made a difference on my symptoms. And if it has, I mean, sometimes I feel better, sometimes I feel worse, so I can't really isolate that variable and say it confidently made me better or not. And I don't know, like, should I just keep trying to find new chiropractors, or should I just give up on that front?
let me ask you, like, 3 different chiros. How long did you stay with each one?
First one I probably saw 4 times. Second one I probably saw, I would see him once a week, I think, for at least 2 months. And then the third one I've been seeing like twice a week for more than a month now. So probably 10 times now.
Okay. So I just wanted to make sure you were giving it sufficient time. So that is sufficient time. Now, what are they doing with you? Are they doing like ART, soft tissue work, acupuncture, or are they just doing crack, 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 see you later?
First guy did like really light manipulation stuff. Like I think ART is what it would be. Like he would kind of just like massage me, it felt like. and I didn't really see him that many times, but that's what he would do. And then the second guy did a lot of adjustments. And then the third guy I've been seeing, he started with ART and then tried adjustments. And then my neck started hurting more, so he went back to ART. And that's kind of where I'm at.
Yeah.
I mean, it sounds like ART, from my perspective, I can jump in here, Cam. As you know, it's if you're on the right spot, we've shared this a bunch of times. It's actually really uncomfortable. So if it's kind of like light massage, or that's the way you describe it, I think that probably didn't really get to the problem areas. It's possible that your neck isn't the problem area, but based on what you described as your symptoms, I think that it probably has a role to play. Also, the other thing to really consider is that a lot of times chiropractors will focus on the back of your neck. So this is the cervical spine. And then there's other areas that are in the lateral and anterior part of your neck. So were they working these areas of your neck as I'm pointing on my video here?
Yeah, a little bit. I honestly have never really had something like that uncomfortable and painful from these people. Like, it sometimes hurts, but it's like it'll hurt for 30 seconds when he does something, and then I just move on. And also, these appointments, it feels like it's like 5 minutes of doing stuff, and then I just leave.
Yeah, that's not enough
Yeah,
time.
that's not enough. Yeah.
How long should it be?
Spend 30 to 60 minutes with our patients.
Yeah.
Really?
Yeah.
Yeah. So there's two schools of chiros. There's old school chiros. I know because I know Cam, his practice really well. And then my brother's a chiro. I work with a lot of chiros. I think there's huge advantages to chiropractic, but old school chiropractic is 10 to 15 minutes, multiple treatment rooms. They see multiple patients at the same time. They go from room to room, and it's like a quick little adjustment. Maybe they do a little bit of soft tissue for a couple of minutes, and then they say, we'll see you next week, type of thing.
Yeah, that's kind of what it feels like what I was doing.
Yeah. See, my patients, I see like minimum 20 minutes. But it can be as long as an hour depending on what's going on.
Yeah.
But then again, so the thing is, like, most chiros will charge, like, I don't know, whatever their price point is, but it's all about volume, right? Like a physician too. If I can see, 20 people an hour, that's better than only seeing 3 an hour, right? The way I do it is I just charge more so that I can spend more time and be more effective with each patient. So it just depends on what type of practice, right? Because I deal with concussion, I know that it requires more time, so I can charge more so I can stay more, which is good because then you can actually dig into some of these issues and get more results.
Mm-hmm.
So I mean, it sounds like you're not really getting what you need with the 3. The thing is, it's like, you don't want to just give up on it, because then what's your solution? Living with it? If you wanted
Yeah.
that's fine. But I think that there's something going on. You just haven't found the right person to get rid of it yet. But it's frustrating, obviously, because it could take forever to find somebody. Like, it's so annoying to have to start up with a new person every 6 weeks because this one's not giving you what you need.
One of the people I also saw was one of the people that's trained in this program and was on the map and stuff. So I was hoping that would be like the one that does everything that you described, but I don't know.
Yeah, see, the thing is, it's like, we train them on concussion. How good their hands are, I don't know. You know what I mean? Like, we train them on it. We teach them where to go and how to do it and whatever else. But if they're not a good manual practitioner, we can't necessarily train that. It's like they need to do it over and over and over again to get comfortable with it. So that's kind of the challenge, is like when people ask me, it's like, oh, it's a neck thing, should I go see like a complete concussions provider? Well, it depends, because some of them don't do very much manual therapy. They're PTs. They do a lot of exercise rehab based stuff. Just because we've trained them, that means they know about concussion, which is great. But how are their hands? Well, we can't really tell you that. It's still trial and error at that point. So I'm assuming you've watched the manual therapy part 1, part 2 video that I've done.
Yep.
Yeah. So the treatment you're getting, does it look like that?
Not really.
Right. So I would say you're not giving up on it. You're still just trying to find the right fit.
What if I just came to Toronto and saw you? Would that be like fine?
The amount of people that ask me that, I've been thinking, I'm like, I should just open up a clinic already, because I don't have a clinic that I work out of currently.
Oh, really?
I do occasionally just see some people out of my house, which obviously isn't great to have a whole bunch of people lining up outside your front door. But like the problem is, if you come see me, you'd have to stay in Toronto for 6 weeks.
Yeah.
And like, are you willing to do that? And then what happens, 6 months from now, everything's good, but all of a sudden your neck starts to bother you again, because that happens, right? Like every patient I see, it's like they're good, and then they'll call me 6 months later and be like, my neck's acting up again. They'll come in and I'll treat them a few times. So it's like, you don't want to have to fly to Toronto every time, every few months, every time your neck goes out, right? You want to find somebody local that that you can rely on. So that's why I always discourage that idea, because you're going to have to come and spend a good amount of time in Toronto. Like, you're going to be living in a hotel and, eating takeout for 6 weeks. I don't think that's a great strategy. Or you'd have to fly in, fly out, which will cost you thousands of dollars in airfare. So I still think it's better to try and keep searching locally, to be honest, just so you have that.
Is it really likely that I'll like find someone that does it like that, or is it kind of like really hard to find someone?
It's hard to say, because I'm not in everyone else's clinics. So I don't really know. Like, for example, in my friend group, people that I went to school with, if I have an issue, I go see one of them and they're great. So it seems like it's fairly prevalent. You generally find people that are good. Now, in the US, the education for chiro is a lot different. And there's like, in Canada, there's one school. So everyone in Canada basically has gone to this one school, and we all kind of are this kind of practice in a very similar way. In the US, some schools are like adjustment only. Other schools are, more like rehab. Like, so it just depends on what school they went to, what their kind of practice philosophy is, how they operate in terms of a business model. So I think the best bet is still to go on the ART website, look for people that at least do ART, find the ones that say DC, because then they're a chiro, which then gives you the joint manipulation if necessary. So you have a DC that practices ART. Then you go to their website and look at the conditions they treat. If they're specializing in, headache disorders and dizziness and balance issues, those are the type of people that are generally pretty good with necks, because that's how they're doing it. Right?
Okay.
If their website is like headache relief and all this, they're probably really good at neck work, because that's how they're able to release headaches, is because of that. So I still think that's your best bet, is start with ART, when you look at the practitioner, look for DC, then from there, go to their actual website and read about the conditions they treat.
And give them 6 weeks.
And give them 6 weeks.
Of seeing them like once a week or twice a week, or what?
Yeah. Generally I do once a week, but I start with once a week. But then I will change things up depending on what's going on. For example, if I see you today and I have you back next week, and you come in and be like, I feel great, then okay, every week it may be too much. So I might push you to once every 2 weeks to see how you do there, or maybe once every 10 days. Because what I want is if you start coming back and you're feeling good by your next appointment, that means I can delay the frequency now. If you come in next week and you say, I felt really good for 3 or 4 days, and then it all came back, and now I'm basically back to square one, then I will want to see you maybe more than once a week, just to try and build. Because I don't want to treat you, you feel great, and then by the time I see you again, you're right back here and we're just doing this, right? Up and down. I'd rather see you, and then right at the peak, when things are still feeling good, but maybe starting to roll over, I treat you again. Now we can get a bounce, and now we can build on that. You know what I mean?
Yeah.
So most of the time it's once a week. That seems to be a good frequency, because like I beat the shit out of people. Like I really dig in there. I really go hard. And like when you're saying, oh, it's kind of light, I know right away that's not the case. Like I would want to be in there and you'd be like, like my head, like you'd be kind of wincing in pain and begging me to stop. Like so I get in there. So a week is good because you can recover from it in a week. But it's not fun if it's being done the right way.
Okay.
Seeing a suggestion
sorry.
in the chat, people who are listening that have found providers in the US are sort of sharing, and that might be a way to go too, is posting on the news feed, seeing if anyone's found a good provider that's worked for them, right? These are, our members who have done the trial and error in the US, and that might be a way to try to find someone, at least, even if it's just a train ride away, it's more accessible than flying somewhere.
The other thing is, two of the people I saw gave me neck exercises to do, and then this guy I'm on right now keeps saying, like, I don't want to have you start doing any exercises yet.
Yep.
And I don't really know if I should be doing them or not. And yeah, so what's your take on that?
Have you done the CFix 2.0 version yet?
I haven't. Well, I started it, but I've been on the mindset module for like a year now, and I'm still struggling with that. So
yeah, I think you should be moving on.
yeah.
Right? Like, I mean, I wouldn't just stay solid on that, because then you're missing the diet, you're missing the autonomic regulation, because all that stuff starts to build, right? Because part of what may be going on from a mindset perspective is that there's autonomic dysregulation. And so I think once you've given it a sufficient amount of time, which obviously a year is very sufficient, right? Like, I even think, like, if you're there for 3 or 4 weeks and you're just doing it, once it's kind of part of your routine, that's it. You don't have to conquer it before you move on. It's making sure it's just part of your everyday, so that you keep doing it as you move to the next things. So I would say go to number 2.0, and start there, and maybe progress beyond the mindset piece, after, 3 or 4 weeks of doing the new stuff that Melinda has in there, because all that other stuff then helps with mindset as you start doing it, right? But in the next section, I talk exactly about when to introduce exercises versus manual therapy. Right? So generally you want manual therapy until you're starting to get a pretty good reduction in pain. Then you start doing proprioception, and then you start doing strengthening exercises. So I tend to agree with your current practitioner more so about, I don't know if you're ready for exercises yet.
Okay.
But I still think that it sounds like there's a bunch of foundational stuff potentially missing, since you haven't got past the mindset piece.
I feel like the mindset piece is still really bad for me, though, and that's why I'm hesitant to move on.
But I mean, if you've given it a year, right, there's other factors that influence mindset. For example, your diet and gut health influences your mood.
Yeah.
So if you're just sitting there on mindset forever and you're not addressing it from the other angles, you're going to get stuck. So I still think that you've given it a good amount of time, as long as you're doing those routines regularly in your day-to-day, so that you keep doing them. Then you add in, okay, let's move on to sleep. Let's move on to diet. Let's move on to exercise. And now you've added all of those together. That's going to help what you're doing with mindset, right? So I still think you should be, progress yourself forward a bit.
Yeah, I agree with that. I think, we've been chatting with you for quite some time. And I think it's okay to sort of say, hey, I'm still struggling with mindset. I am working on that. But I think the two areas that, you're just, feeling stuck with is the mindset and the neck dysfunction. And it's feeling like you can't, none of them are getting any movement. So I agree with Dr. Cam's suggestion. There's no harm in moving forward, trying, Dr. Hrkal's sections, seeing whether or not you can create a little bit, even like an anti-inflammatory approach, right? With the diet and, a little bit more movement is likely going to be supportive for mood as well as for pain. So it could be just something to add to the repertoire that you're doing, even though that mindset is still such a struggle. It's sometimes you have to mix it up a little bit, and I think you're there, and that's okay. I know we've always reinforced, make sure that you spend the time where you need it the most, but sometimes, like in your case, and you've been really working on it for a long time, it's okay to sort of move forward and see if you can get some movement in other areas. Yeah, great suggestion, Dr. Cam.
Yeah, I think that, like I said, I'm just going to reiterate this. The goal is not to conquer mindset before you move on. The goal is just to make it part of your everyday. Once it's part of your everyday, where you don't even have to think about it again, you wake up in the morning, you do this, you do some grounding activity, you do some breathing, and then, mid-afternoon, you may do it again. You create a nice, relaxing environment before bed, and you're doing once it's part of your just routine and you just do it, you don't have to think about it again. Now it's time to move on. Now you keep doing that, and then you add in the next component, and then you do that until that's part of your everyday. Then you add in the next component, and then you do that, and you keep now you're doing all these different things together, but you've added them in a gradual way that it's not overwhelming, but all of those things feed in. Right? Like once you start getting to nervous system regulation, that feeds back to improve the mindset stuff that you're working on. Then you get to diet, that improves the mindset piece even more. Then you get to exercise, that improves it even more. And so you're working on the strategies, but all these other pieces, everything is so interrelated that we can't just focus on, doing the mindfulness piece without adding the rest of it in, because exercise is one of the best mood boosters there is. Gut health and dysbiosis and inflammation is related to mood and anxiety. Sleep dysregulation is related to mood and anxiety. And so if we're just focusing on this one piece, we're missing all the other factors that go into that piece. So it's like, get the strategies. Once you got the strategies and you're working on it regularly and you're diligent on it, now add the next piece. Then add that in over the next few weeks, then add the next piece. And now you have this comprehensive package that's been added in a gradual and sustainable way. And that's it. So I think you need to kind of do the rest of this program, but do it on 2.0 because it's going to be just that much better.
Will do. Thank you.
You're welcome. Okay. Last one here on the main, and then we'll go maybe to chat.
I don't know. Maybe you just answered my question actually with this last one, because my question is about the program and how to proceed. I had my concussion and or whiplash 4.5 years ago, and I found your program 1 year ago. And right now I'm working with the hormone section. But I have some huge external stressors that affect me a lot. I have huge family conflict due to this, my accident and everything that followed. And I also have a lot of worries about financial situation, and just the whole thing is very stressful. And I've worked and I am still working on the tools from Melinda section and the diet and sleep parts, but because I have these huge external stressors that affect my mood in terms of stress and anxiety, and also kind of a low mood in general, that also affects my sleep. And so I'm not sure that I really have the right building blocks or foundation to build the rest of the program on. And so I don't know if I should move on, because will it work then? But on the other hand, I think I can also stay here until those things may or may not be resolved, because then who knows how long I'm gonna stay here. So I wanted to hear you maybe have any thoughts on that. And also, I was thinking, since it's taking me so long to get here, to get more than halfway, I was thinking, would it make sense that I switch to the new program? I don't want to miss anything from the old one, but maybe it's taken me so long due to all this external stress, but also because my eyes are really bad, so it's really hard for me to follow the videos and yeah.
Yeah, I think that last question's a yes. I think you just switch over. You can even re-listen. We also have the audio files now in the new course, so you can kind of listen to the ones that you've already watched in the first program. There's also going to be more richness to it. Things have been updated a little bit. So I think you can kind of move over. You could start at the beginning and just listen to the audio. You might, pick up some new things. Particularly, I would recommend starting at the beginning of 2.0, given that you just shared with us that you're in sort of high stresses right now.
Yeah.
And it happens, right? Life is happening as you're going through the program. So I think the invitation is really just to, do your best to go through it, but recognize that if there are a lot of acute stressors in your life, it's going to be harder to make that progress until some of them reduce a little bit. If some are kind of passing stressors, then you might sort of just work through the program once they're passed. If there's stressors that are going to be there, right? Financial stress is just something that sticks around. The recovery mindset and the regulating your nervous system is going to really support you to build what we talked about with the last member, is this distress tolerance. Okay, there are stressors in my life, but it doesn't mean I can't still move forward and build resilience. So I think, it might be practicing self-care when you need it, right? If there's a lot of stress all on your plate, it might be too much to try learning new things and implementing new things for your concussion recovery, and you may need to wait a bit, but not to wait too long, right? There are a lot of things within 2.0, within the program, that can support you to help build resilience to stress, and that's an important piece too. So as much as it's individual, and we can't tell you when to do it or how, what stresses are more important than others, it is, something that you have to tailor for yourself. But it's sort of this fine balance of knowing when to take care of yourself if stress is too high, right? And maybe taking a break, but then coming back and recognizing that doing the program is going to help you build that resilience to stress. And that's an important piece as well.
Okay. Yeah.
Yeah, I would agree with that. I think that, like I said, you don't want to try and blow through it to try and do everything, but you do want to kind of progress yourself, right? And so I think the kind of rule of thumb is, like, once you go through a section, you implement, kind of that one piece at a time. Once it becomes part of your everyday and you're doing it as a regular practice where you don't even have to think about doing it, it's just part of your routine, then you can add the next piece, right? You don't have to stay there forever until you've conquered it. You can just add the next piece because all of it feeds back to itself. So I think that starting over with the new one for sure, right? You're not missing anything in the old one because everything in the old one and more has been added to the new one to make it even better, right? So, the new one for sure. So, and I think that just gives you another run through the mindset piece at this time, which is great. And that's kind of what Melinda was saying, right? You get another run through it during a highly stressful time. Maybe you just kind of get reminded of some things, and maybe it helps you kind of, just to feel better right now.
Yeah, we often pick up things that we need in the moment. So when you went through it last, you may not have needed some of those resources in the recovery mindset. Whereas now, if you're in a higher stress place, you might really pick up more of those coping skills that you can add to your toolbox and be able to use them. So I think that could be a way to go.
Okay. Yes. Okay. That's great advice. Can I ask just another question?
Sure.
I'm working with a naturopath here, and she's advised me to start now craniosacral therapy and also Alexander technique. But I know that you say that manual therapy isn't until the end of the program. But I was thinking this craniosacral therapy, I never tried it. I go to an osteopath, but I think maybe that would be helpful for supporting my body, my nervous system in this stressful period. I don't know what you think. Should I wait, or would that be something I could try to help me?
It can go either way.
Yeah.
Okay.
So it's just a bit of a risk, right? Because yes, your biomechanics, your anatomy can influence your nervous system. So for example, people with neck dysfunction often have autonomic dysregulation, and correcting neck dysfunction can help to support, regulation of the autonomic nervous system. So in some cases that's good. But if your autonomic nervous system is dysregulated and you get manual treatment, sometimes that puts your body into more of a state of fight or flight because it might not feel safe yet. So it can go either way. For some people, they can introduce it early and it's really helpful. For other people, it can just flare them up really bad because they're not ready for it yet. And everyone is different, and there's no way to tell whether or not you're ready for it or not.
No.
So it's one of those things, like, if you're willing to risk it, you can give it a shot and see how it goes, and it might be super helpful. Or it could kind of backfire. I mean, you're not going to do anything that you can't undo, so don't be too afraid of it. But it can potentially, just make things a little worse.
Yeah, I always kind of say, like, can you build up some of the nervous system regulation before trying a new physical treatment? Because at least then you have some of these resources to help balance out your nervous system in the case that, as we've talked about, for example, like a chiropractic adjustment or chiropractic treatment creates an initial sympathetic response in the body, right? That's another stressor. So if you have some practices that you're, more consistently doing to help balance out your nervous system, be able to stay within what we call that window of tolerance, then you're more likely to have success with it versus maybe a flare following the treatment. So that's why we have it in the order we do. Not that you can't go ahead and do it, but I always say, hey, is there like a good handful of things that you can have under your belt in your toolbox to support you if you decide to sort of skip forward and do a manual therapy before you're there in the program.
Okay, thank you. That was very helpful. Thank you so much.
You're welcome. Good luck. Nikki, anything from the chat?
Yeah, there's a couple questions in the chat. One question was how to lower red blood cells when they are elevated.
Yeah, so I'll take this one. So red blood cells, RBCs, is what you see on blood work. Just for context, that's the actual total amount of red blood cells that you should see in a sample. There are also a whole bunch of other parameters, which I don't know if they're talking about as well, which is hematocrit and hemoglobin. That is a subcomponent of what's in your red blood cells. And then there's a whole bunch of other parameters in the size and shape of your red blood cells. Actual only RBCs, they're elevated when your body is trying to usually compensate for a lack of oxygen. So there's a number of conditions that can cause an elevation. So I'll always talk to your healthcare provider, but I'm assuming this question is coming from, well, I've already seen my doctor and they're kind of like, I don't know what to make of this, or they're not really worried about it. So one of my sneaky little clinical pearls that I've seen over the years is that everyone's heard of something called altitude training. Altitude training is when an athlete goes to an area where there's a lower level of oxygen, and usually higher the altitude, the lower the oxygen level. So they'll go and train in the mountains of Japan, or they'll run up and down Mount Kilimanjaro in Africa. And the idea here is that they're training their body in a situation where there's lower levels of oxygen. So when they go back down to their competition, their body is compensated and it adapts by producing more red blood cells. So then they have more little oxygen carriers in their blood to deliver oxygen to their muscles. This is kind of like a way of doing blood doping without actually infusing any extra medication or blood into your system. Now, how does this relate to you potentially? The little pearl that I've seen is that, can anyone think of another situation that happens during a person's sleep that might deprive somebody of oxygen? Sleep apnea, right? So one of the things that I've seen is that when all things are assessed and there isn't another organic reason for those RBCs to go up, sometimes it's actually that a person doesn't really know it, but they're not getting enough oxygen during the night. So this could be indicated by snoring. It can be indicated by their partner saying, yeah, honey, you're kind of starting and stopping breathing. You kind of have to catch yourself, and you don't even realize it because a lot of times this is something that's happening while you're sleeping and you're unconscious. You don't actually realize it. So that's one thing to follow up on with your doctor. And if you do have sleep issues, or you do feel like you're tired when you wake up, or you're kind of foggy when you wake up, you're just generally not ready to get up and get after the day, this could be because you have kind of a low-grade apnea happening.
Great. One more question here, also for you, Dr. Hrkal. What or where are the best places to buy supplements? I know you went over what to look for in a seminar, Dr. Hrkal, but it's hard to look at the bottles in store before my head hurts. Are there top ones from Costco or health food stores in Canada?
Yeah, that's a great question. You know, I myself and Melinda, Dr. Marshall have kind of like struggled with this question because out of all the things that we talk about in our program, that's the one piece that's like you got to go to a retail store to buy. Everything else is like you can implement on your own and go to a therapy. So it's kind of administered for you. But this is one of those times where we're like, okay, we're talking about all these different supplements. Go find them. And the reason we've kind of stopped short of actually giving you brands is because as a concussion fix program, we try to be brand agnostic, which means that we don't want to be here touting, hey, this is the brand. Now, we've, I think, thought about this. We're thinking through a couple options because I do think this is a big pain point for a lot of people, is like trying to source good quality supplements. There's a huge difference out there. So you can go to Costco and find some decent stuff. Not saying the quality's bad, but it's just not therapeutic for people trying to recover from a concussion or from PCS. So we're thinking about some options that are going to come out in the near future that are going to help people make some of these decisions and really kind of maybe deliver it right to you. So that's one possibility that's coming up as part of 2.0. In terms of answering this question right now, there's a couple simple ways of doing it. If you're working with a healthcare provider, that's an easy way of getting high quality supplement recommendations because they generally are working only with the best. That's number one. Number two, you can use the supplement sheet, the summary sheet that we've created, which is a more recent document that actually goes in and shows you the evidence-based dose for these particular supplements, and then try to go to a health food store and work with one of the clerks there and say, hey, listen, I'm looking for a fish oil that has 2,000 milligrams of DHA. You don't have to go look at the shelf. Just they're there to help you. You're not asking them to treat you. You're not asking them for their recommendations. You're saying, I want this amount. Give me one or two options that have that amount and let them just walk you around and show you. A lot of times the people that are working at health food stores are registered holistic nutritionists, or they have some sort of diet background. Some of them are quite knowledgeable. And as long as they're not giving you treatment recommendations in the aisle, which unfortunately happens a lot, then they can be a huge asset to take out the whole kind of like, I'm overwhelmed and overloaded by all these options. So those are two kind of like ways you can do that. And then the other option, is, us you're getting a list of supplement brands that are good. And, I've given lists before, but there's just so many and there's a lot that are good. I like to use kind of more professional brands because the commitment to potency and safety and purity, what's in the product, is higher than stuff that you can just get on iHerb and just order it up. So the cheapest thing often isn't necessarily the best. I don't know, Cam, Melinda, is there anything else you want to add without us actually like giving people the exact brands, which honestly changes if you're in Denmark. You're not going to find the brand I'm going to tell you here in Canada. So that's another reason we actually haven't gone ahead and been like, you need to go get AOR's curcumin or whatever the brand and the company is.
Yeah, I think that I was thinking about the same thing. The first one was about just having a support person come with you.
Yeah.
Or using, like, if you do go to a health food store, using the nutritionist there or the clerks that work there to get them for you. And if you can't walk around the store, you can just go in and say, hey, would you mind grabbing these things for me and bringing them to the front? And you can basically just stand at the front, make your decision. I like what Dr. Paul said about getting one or two options, and then you kind of choose from there. The other thing I was thinking about is like financial considerations. Cost is sometimes really affordable, and that's fine if you want to start there. I mean, it's better than nothing, I would imagine. And if health food stores tend to be quite pricey and quite expensive. So if that's not within your affordability right now, but Costco is, or another like a Walmart or another big store that helps, a department store that cuts down on cost, bring a support person with you because it is overwhelming and you have to do the work yourself when you go to a big department store. So if you can bring a friend or a family member, print out the list that Dr. Hrkal has provided for you in 2.0 and have someone look for them for you so that you can at least get the supplements started that you need without having to do all that work, right? You're maybe not there yet as far as visual exposure, or your symptoms may be too high to be going into a big department store, especially things like a Costco or a big department store are going to be huge triggers for people just starting out. So those are my kind of two thoughts.
Are there any websites which will just like kind of rank like reputable brands? Like if you're like, oh, I need a magnesium supplement, like here's the top brands,
No, well, because a lot of them sell it, right? And the reality of so every single health food store now has like an online store, right? You can go directly to the customer, to the company. They all have stores. And now Amazon is selling all those brands, and places like iHerb are similar. So these are like online kind of like brokers. They generally are very expensive because especially reputable companies, they do not want to be undercut or seen as being undercut by Amazon. So usually you pay for convenience with Amazon. Amazon is generally more expensive. So there are some stores that are considered more premium. There are some brands that are considered more premium. And there are stores that people go to because they know they're always getting deals on supplements because they're always on sale. So unfortunately, Cam, there isn't a ranking because it's so biased based on sales. If I wanted to create a supplement retail online space, you have some customers that are going to want to buy the cheapest magnesium because they just know magnesium is good. And there are some that are like, I'm looking for the best. And the volume is in the cheaper one. They're going to sell more of that.
Yeah.
So there really isn't that. I thought about this as like as an idea to help my patients or to help community. It would be a lot of work to rank everything. You'd have to set up the criteria. You'd have to actually vet it all. But maybe with the help of AI, this would be a little bit easier to do.
Mm.
And the one thing I was thinking too, when you were talking about Amazon, is there might be some reputable ones on there, but a lot of people also can empty a bottle easily and fill it with whatever.
Yeah,
I've heard it.
I've heard that a lot of shit on Amazon is fake. Like,
yeah, so you just need to
100%.
be careful if you are going the Amazon route to make sure that you're buying, because some companies do directly sell on there. So if you're going to do that direct company.
Yeah.
There's like it looks exactly the same. Like they put the label on, but it's actually not it. It's a total knockoff. So they're not even like emptying bottles is one thing. One of them is like, the other thing is like misrepresenting it and looking like, I mean, this is the world of fakes that have been in the, in the cosmetic and the kind of fashion industry for the longest time. Like, here's my fake Gucci bag, but it happens now in supplements.
Which is scary.
And medications too. Medications is huge.
Yeah.
Like, get this Viagra, and it's like $5 rather than the $50 the actual brand name pharmaceutical. And so, how do you think it's made?
Yeah, you want to be an educated consumer, right? I think we fully support, doing your research. It doesn't have to be the most expensive brand if you're looking at something for more affordable, but absolutely think about where you're buying it from to make sure it's safe. Especially when you're living with PCS, last thing you want to do is, take some knockoff version of something that's going to aggravate you. So, absolutely, I agree with that.
All right, we have one last question. My husband and I were away from home for 5 weeks to help family through a medical crisis. Upon returning home, we both have increases in our symptoms: minor tinnitus, headache, fullness in the head and ears, neck pain. We identified there are responsibility pressures at home that we could put on hold while away, although they were situational stress involved with medical situations that weren't ours. There are also lighting differences, EMFs, etc. Just wondering thoughts on that.
Yeah, this happens a lot actually. One of the patients I see from time to time was actually a member in this program as well, and I was treating her neck and feeling pretty good. Went to Florida. She was really worried. Went to Florida to Disney with her kids and like a whole bunch of other people. And in Disney, they're walking around. She's doing like 20,000 steps a day. They're going on rides and roller coasters and eating out and whatever. And she had no symptoms. Then she comes back. All her symptoms come back. Right? And even worse, like she was at like an 18, I think, before she left. And now she's at a 40 something. But fine while away. Right? So there are a lot more pressures at home. Like when you're out and about and socializing, sometimes you kind of just forget. And you kind of get out of your mind a little bit and you're more present, you're in the moment, you're dealing with other things. And then you come home and then it's like regular life. You're not having the same social interactions every day. And sometimes you have a stressful event and then sometimes you feel it after. So it could be a result of that, right? The stress of that particular thing coming back. Now all of a sudden now it's hitting you. That that can happen as well, right? Your nervous system's going to be a little bit like, overwhelmed. You're just kind of running on fumes while you're there, and then you come back and crash, right? So it can be that. There's a whole bunch of potential reasons for that. Melinda, you want to?
Yeah, I mean, it's like the Sunday scaries, right? For everyday people, when you're thinking about going back to work, all the to-do list piles up on Sundays. People who do like cottage country or go away for the weekends, oftentimes you start to get a headache and you're not feeling well on the way back from a nice weekend away and thinking about everything that you have to do. Often we're not aware that that's happening. This just seems like maybe a prolonged version of it, right? You went away, your mind is really focused on someone else's health concerns, which means they're probably less focused on your own health concerns, like you mentioned in your note. And then you come back and it might just be this sense of like, oh, wow, okay, now I'm back to, having to take care of myself and manage responsibilities. It is a really common pattern and something just to keep in mind, right, of how much stress can impact how we feel and how much stress can impact our concussion symptoms. So it might just be that sense of like, can you double down on some of the stress reduction, the nervous system regulation, the mindset pieces to support yourself during the transition back? There's all sorts of other potential reasons that happens, but I think stress is a big one, and return to responsibilities is also a really big one.
Great. Good spot to wrap up today's Q&A. Thank you, everyone who asked questions, everyone who is here supporting in the chat, anything like that. We appreciate it. Otherwise, I hope everyone has a fantastic day. Bye.
See you later, everyone. Have a great day.
Thanks for joining us. See ya.
Thanks, guys. Bye. Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.